Ontario is facing an unprecedented staffing crisis in our hospitals, in our long-term care, in our home care.
I have nurses who cry before they even get into work.
They drive home in a car and they cry.
Someone has just gone to be a waitress so that she can get a day off.
Their anxiety level is to the max.
Because people cannot continuously work the way they're working.
Leading into the pandemic, Doug Ford cut hospital funding to below the rate of inflation. By the time the pandemic began, Ontario had the fewest hospital beds left of any province in Canada. And then he brought in wage restraints. And so while the nurses and the health professionals were expected to risk their lives providing care through the pandemic, he put in wage restraints to ensure that their wages couldn't increase by more than 1%. Now that inflation is 5%, they are experiencing real wage cuts. Doug Ford has chosen not to deal with the crushing workloads, the burnout, the wage problems, and the other stresses that are causing healthcare workers to leave. He has chosen not to take the measures that are necessary to address the staffing crisis in our public hospitals, even though for-profit privatization will make that staffing crisis worse. But they have backtracked when they faced enough public pressure.
We commit to talking with our members and our neighbors and our friends.
If we all work together, we can ensure that they cannot do this, not on our watch.